And we've been talking about flipping the script in children's mental health this month and just looking at things in new ways. And we know you're part of the heart and soul of Jackson Public Schools. So we just we're asking some different leaders what they think and how they most wish that script could be flipped in their system. So how do you think we could flip the script for children's mental health in partnering with JPS?
So one of the ways, and again, thank you for this opportunity. One of the ways that I think I would like to see us flip the script is to do some partnership efforts in terms of when we serve students that may be having some mental health challenges, that we really involve the families and then make families feel comfortable that it's okay to seek help and assistance and really try to address it from a cultural perspective and eliminate the stigma so that they know that it's normal, it's nothing wrong with them. We do annual physical checkups so that we make sure that our bodies are well. So doing a mental health checkup annually or as needed if we don't feel well mentally, that it's okay, and that we encourage our students to embrace that and flip the script and have align the support of parents.
I think one of the ways that we're actually trying to tackle that now is through a partnership with the University Medical Center. We took to our state board earlier this spring a grant request for a grant to UMC to basically provide a bunch of training and support to teachers, recognizing that there's a mental health professional shortage in the state, and particularly outside of the Jackson area. 80 of our 82 counties in the state are designated as mental health professional shortage areas. And there's some research recently that shows that students will experience mental health problems, inattention, anxiety, irritability, sleep problems that often come about as a result of a traumatic event or an event such as a pandemic. And so we're working with UMC over the next 3 years to provide some training and support to cohorts of teachers across the state to help them better understand how they can manage mental health needs and behavioral concerns of students over the coming years, and also to connect them with specialized behavioral health care workers in the state, and to offer them training on behavioral management strategies to use within the classroom. And then beyond that, we also are working to not only provide the training for teachers in the state to these pilot groups of teachers, but also to offer telehealth and teletherapy services to students through existing structures, through telemedicine supports across the state, to try to eliminate that transportation need, to try to eliminate that barrier to access, particularly in rural and underserved parts of the state.
So we just wanted to get your thoughts today on how you'd like to see that script flipped in the public health system, or ways you may see it already flipping.
From a public health perspective, we're always trying to look upstream, right? Sort of like, what are the causes of the cause? And obviously for child welfare and youth mental health, there's a lot that goes into what's going on early in life, early childhood. And that's really a part where we have a unique opportunity to play a valuable role, where they have a safe environment, a supportive environment. And we know there's programs out there that we're looking at, that we're hoping to adopt that can help with child well-being and child welfare in ways that are evidence-based, right? So we have this perinatal high-risk management plan, but we need to really transfer it so that it helps kids in a lot of ways by reducing not only their physical risk, but their mental risks, trying to reduce in the family setting adverse childhood experiences, because we know how important those are in child well-being. And then past that, we're very active not only in the early intervention business, right? So kids who have developmental issues, and a lot of times that will be related to mental health well-being, and then also on into early intervention with our EPSDT screenings. So there's a lot we can do, but we're always trying to look upstream.
I really hadn't thought about that part of flipping the script, but it really is. It's flipping the script from the very beginning.
Yeah, and for us, upstream is so very important. There's a lot more that we can do, but the other thing about flipping the script is not doing things like the way they've always been done, right? It's really easy to have that sort of institutional momentum where just because you've done it that way, you do it this way all the time. we're trying to look at our interventions, the things that we're doing for families, for communities, for individuals, mothers and babies, are based on a sound foundation of evidence, right? Evidence-based programs. And we've done a lot of work with our teams, a lot of our leadership, making sure that they know what those tools are. We have had a in-depth training with a MIT group called JPAL, which basically does a lot of evidence-based sort of work for making sure that what you're doing can be studied and evaluated and shows that it's really doing what you think it is. And then we're working aggressively with a school from Harvard, looking at evidence-based approaches to infant health. So making sure that, it's not important just for us as a health agency, but really this goes to all sort of state and public entities, that there is a strong evidence base, that if we rely on that, we can sort of change the narrative from, just doing the same sort of, day in, day out sort of work that we've done forever, when we can, say, hey, look, there's something exciting, there's something we can do that can make a difference for the state of Mississippi.